done.
Thanks, Jen, and thank you, Sue. Just felt so great to move around a little bit. And I just want to say that what a fabulous morning we've had, just completely inspiring. And I think we're just ready to just have another very informative and inspirational opportunity. So it's just really my pleasure to introduce to you Sarah Lenz. And Sarah is a Senior Vice President for Policy and Brain Health at AARP's Policy Research and International Affairs. And I've had the pleasure to know and work with Sarah for a few years, particularly in our work with Dementia-Friendly America. Now, Sarah leads AARP's policy initiatives on brain health and care for people living with dementia, including serving as the executive director of the Global Council on Brain Health. I think as we heard from our earlier panel, that dementia and brain health is an issue that is global, affects individuals and families throughout our world, and the world is engaged in brain health and on helping people with dementia live better lives. Now, the Global Council is an independent collaborative of scientists, doctors, and policy experts convened by AARP to provide trusted information on brain health. Now, previously, Sarah was a senior attorney and manager at AARP's Foundation Litigation, conducting healthcare impact litigation on behalf of older persons. She's also formerly served as a commissioner for the American Bar Association's Commission on Aging, Law and Aging. Now, Sarah's a valued member of many national organizations and advisor to many, including the Administration for Community Living, and as I mentioned, the Dementia-Friendly America. So it's just such a wonderful pleasure to welcome Sarah to our summit today. Take it away, Sarah.
So thank you, Dawn. I appreciate that very warm and kind welcome. It's wonderful to see you and work with you over the years. I can tell you, I think one of our very first meetings over now going on a decade ago, I think, you were so generous to come to AARP and share your Minnesota experience with us. And we just were so grateful and so impressed. And it's been a great pleasure to work with you through the years. It turns out that today is actually my 25th anniversary with AARP. So it's really fun to be able to meet with you all and talk about a topic that is near and dear to my heart, because frankly, I think if we're going to make progress in dementia and if we're going to make progress on brain health, engaging with and integrated in the community is the answer. I think that the opportunity to talk with you all about this is the Dementia-Friendly Community Summit. This is ground zero, frankly. I think I may be sharing things you already know. I've learned so much over the years from the work that I have been privy to, whether that's Act on Alzheimer's, whether it's AARP Minnesota. I'm gushing because it's a tremendous opportunity, and I really appreciate the chance to talk with you all. And I'm going to test out my tech skills here by trying to share the screen and make sure I've got the right one up. So we'll start by this one and see, is this the one that you can see? I don't want you to see my notes.
Yes, you're all set. Well, actually, we see your next slide, but I think that's okay. We see your main slide as well.
We can see your notes as well, Sarah.
I think if I switch screens, display settings up here, maybe swap presenter view and slideshow, maybe that will.
Yes, try that.
How does that work? Okay.
No, nothing changed.
Nothing changed.
Can you go back to your share screen options? So can't stop your screen share.
How's this one?
Perfect.
Okay, great. Okay. So you can teach an old dog new tricks. So you probably already know this, but I wanted to set our conversation with some basic facts. You do know that most older people want to stay in their homes and communities as long as possible. By having dementia-friendly communities, age-friendly communities, that is the name of the game. As you know, AARP has been a long time proponent of age-friendly communities. And we, quite a while ago, worked to think about how age-friendly and dementia-friendly communities could complement each other and not compete. And that has been a fundamental principle that we have tried to facilitate. And I know that you all have done that as well. But we have more than 6 million Americans in the United States of all ages have Alzheimer's, and those are the only ones we know about. We all know the challenges with diagnosis, and many people go undiagnosed, and the challenges with the data about we might know people who have been diagnosed with Alzheimer's disease. That doesn't mean we're capturing everybody who actually has a dementia or a different form of it, or who just happens not to have been diagnosed. The same problem, of course, goes to state statistics. And we know in Minnesota, you have at least 100,000, and it's growing. It's clear it's growing. There have been pockets around the world where we've been able to see changes in incidence, in that we actually see rates going down, and they think that this is due to better cardiovascular management, perhaps education. The overall numbers, of course, of people living with dementia are not going down because we are simply aging, and age being the greatest risk factor, our numbers are going up. Even though I'm telling you some of these stark numbers, which you probably are familiar with, many of you probably live it or have personal experience. And when you do, it can be all encompassing. But if we step back a little bit and look at what the research shows us, is that almost half of adults 40 and older think that it is likely that they will experience dementia, that they themselves will have dementia as they age. It is a number that is a very scary number. What I wanted to say is, it's actually a much smaller number than that. It is not a realistic fear that half of all adults will experience dementia as they age. Of course, the older you are, the more likely it is, but it is by no means inevitable that you will have dementia. And people often confuse cognitive impairment and dementia as being the same thing. Normal cognitive aging, of course, is not disease state. So getting at some of the questions that people are afraid of about aging and its relationship to dementia is something that AARP is spending a great deal of time trying to figure out. And the Global Council on Brain Health tries to distinguish. We know that 1 in every 5 people in the United States in just a few years is going to be 65 or older. Those are stunning numbers. So whether we're talking about disease or we're talking about normal cognitive aging, we are having a huge number of people who will have some challenges with their cognitive functioning, which of course means a lot for their independence and their well-being. We know that the caregiving situation is going to be ever more challenging because as our population ages, the number of children under 18 is decreasing. And that has large implications for our workforce, large implications for family caregiving, and the ability for us to take care of ourselves and our loved ones. And if we do not make changes in the future by having disease-altering lifestyles or communities that facilitate better brain health, or a disease modifying pharmaceutical or treatments that can somehow stem the tide of Alzheimer's, under current projections, we're going to have 13 million people around the country. But I'm thinking we can actually begin to make a dent in it. But remember, it's not just the people who are living with disease or dementia or cognitive decline. We've got 17 million people in the United States who are acting as caregivers, whether they're spouses, whether they're friends. They typically, more often than not, across the United States, are women. 2/3 are women. 2/3 of the people who have dementia are women. But there's also a disproportionate effect in communities of color. And that is actually the topic. We actually just gathered the Global Council on Brain Health this morning, right before this call. And we're dealing with the issues of how do we build brain health equity across the globe to address some of the gender, race, ethnicity, geography, and socioeconomic statuses that lend to greater risk for people for cognitive impairment. We here in the United States are very keenly aware that Black Americans and Hispanic Americans are more likely to have dementia, but are less likely to be diagnosed, which is a problem in our healthcare system in general. But here's the point that I wanted to make, that cognitive decline is not inevitable. Although about 48% of adults believe that they will have the disease themselves, 6 out of 10 believe that cognitive decline inevitably occurs with aging. I just want to emphasize this point. It is normal for your brain to change as you age. It is not normal for you to have cognitive decline so significant that it interferes with your daily function. That's when it spills over into disease. So the vast majority of us will not experience this. And here is a very hopeful message. If you are a caregiver or someone worried about it, if you're part of the 6 out of 10 Americans over age 40 who think this, but modifiable lifestyle factors can reduce risk for cognitive decline up to 40% is the latest analysis out of the Lancet study. And there are strategies to help people reduce their risk to their brain health at any age. But I'm keenly aware that I'm talking to the dementia-friendly community. And so what I want to say is, yes, we're very interested in reducing risk, and we're very interested in building the awareness you can do something about it. But what's important here, the very same interventions that can reduce people's risk, improve quality of life for people who are living with dementia or cognitive decline right now. And that's why the intersection of what dementia-friendly communities can do is so important. Because, and I will talk about this ad nauseum, about the 6 pillars of brain health, but it's there that communities can support and sustain healthy lifestyle behaviors that can facilitate these strategies. So a lot of people will say, yes, I know these common sense things. Exercise is good for you. Diet is good for you. But only about half report engaging in the activities that can help with respect to diet and exercise. And those are the ones we actually know a lot about and people report they know about. But when people tell you that they're engaging in brain healthy activities, whether they're getting 150 minutes a week, if you look at the stats, they're not. Now, I really appreciate Sue's presentation right before me. We do a lot of sitting and we exaggerate how much exercise we're getting. We really need to figure out how to exercise more. And the way to do that is have community create the environment in which all of these behaviors are sustainable and possible. So not only can we reduce people's risk, but even if you go on to develop dementia, if you delay it for up to by 5 years, which is totally possible, it will cut the incidence rate in half. So even if we're not talking about eliminating dementia, but only slowing how it sets in, this is an important point to try to achieve in our community. So what do I mean about age-friendly communities and dementia-friendly communities supporting behavior change? Because it's one thing to say, I'm going to exercise more. But if our communities make it difficult to do so because we don't have sidewalks, because we're all in our cars, because we don't build into our society the things that support us doing these healthy behaviors, we're never going to reach everybody in the community we want to. But if instead our communities are structured and support ways that the 6 pillars are just a part of our natural life, that it's easy to get the right food, that we're communities and employers and the rest of what makes up the fabric of our society supports and engages sleep in a way that is sustainable, that is how we get massive change. So you probably are familiar with the age-friendly 8 domains. And I put that here because I know that Act on Alzheimer's used the AARP WHO model, that it is through the intersection of these domains of livability that we can create opportunities for healthy aging. And if you look at the Dementia-Friendly America's 10 sectors, you'll find significant overlap. What's interesting is the intersections here. And sometimes we say something that is age-friendly can be dementia-friendly, but not necessarily. But something that is dementia-friendly necessarily is always age-friendly. So just to go back, we have 8 domains for age-friendly, but there are 10 specific ones that are called out here for memory loss supports and services and emergency planning and first response. Communities of faith, care throughout the continuum that are really specialized when it comes to dementia-friendly communities. You'll see it reflected here to some extent, but calling them out and being very specific about them is what gets us to the place where including people living with dementia and their caregivers deliberately within our planning. So that's that deliberately part. Planning and making livable communities support healthy living. And it's making us think about brain health through public health that we get to both the elements of risk reduction and supporting quality of life for people living with dementia and their caregivers. And by thinking ahead, we can account for the needs of people at all stages. Of course, this is not just people who are over the age of 65 and who you think are typically our AARP members. They are the disability community. We know that people with intellectual disabilities have incredibly high risk for living with dementia as they live longer lives. So age may not always be the marker for who needs these sustainable, livable communities. It could be physical disabilities, it could be intellectual disabilities, it could be the onsets of diseases or comorbidities. And that's what we're talking about when we look to the communities for solutions. And here is our AARP policy, frankly, underlining it's about land use, it's about infrastructure, it's about deliberately designing equitable and inclusive allocation of resources so that we direct the resources to communities who need it the most. Housing and transportation, these are all areas which if you're just looking at the healthcare system, you're not finding the opportunities to change the way that we want it to be. But of course, policies and programs that foster positive health outcomes and delivery of services typically is thought of as healthcare delivery. But it's the social supports, actually, rather than the healthcare supports, that make these things possible. And we have to figure out better ways to radically integrate social services and supports with our healthcare system and with our family caregivers in order to address the need. So I think I've hit this over the head, but I'm hoping that you'll radically agree with me that our answers are through age-friendly and dementia-friendly communities that foster brain health at all ages, at all stages of life, and throughout the lifespan. We at the Global Council on Brain Health recently issued a report on how to sustain brain healthy behaviors. And we had an entire section devoted to individuals, but realized that it's the context that matters. And so we created an entire section around what communities can do. And then the third pillar, or the third prong of focus, was for policy thought leaders. So individuals, communities, and policy leaders. And when you think policy leaders, I'm thinking governments, but the intersection between governments and communities is where we can drive the change that can make a difference. The first thing, and you'll see this is true for whether we're talking about individuals or we're talking about communities or we're talking about policymakers. The number one thing that every entity must do is set a goal. That is a key part of determining how you're going to go about making a dementia-friendly community. But health coaching and peer-to-peer health coaching is something that I think dementia-friendly communities can excel at. And you can become the coaches for the rest of the community about how to do this, because you're reaching out to the banks, to the housing, to other parts of the community, and you are the health coaches, frankly. We've tried to help community groups who are interested in this be strategic in how they deal with their communications. And we convened many communication experts around what are the fundamentals of how you're going to communicate it. If we're asking you to be the health coaches, how are you going to best communicate this? And so for the full report, we suggest you take a look at the 7 key questions that we've laid out, and you can get our report at the globalcouncilonbrainhealth.org. Tailoring messages to targeted audiences. Now, I'm doing a lot of talking, but the key is really about listening. And so I'm hoping that I have enough time to engage with you in Q&A. But taking an inclusive, multifaceted approach, collaborating across sectors, sounds like it's tailor-made and drawn directly from the principles of dementia-friendly communities. And finally, keeping track of the response. We have to measure outcomes that matter to individuals. And as part of the effort, and I know Dawn was a big part of this, we created a proposed measurement system available to Dementia-Friendly Americas, and asked all organizations that are trying to create dementia-friendly spaces, dementia-friendly interventions, dementia-friendly communities, to take a look at how do you set evaluations so that you can find out what works and what doesn't, and so that you can shift when you find out what is working, to put your resources, and I know we all have limited resources, but to shift them where they're most effective. So I ask you, if you haven't seen it, you can take a peek at Dementia-Friendly America at that evaluation guidelines. We realize not every community can have a full-blown academic evaluation followed up for years. but it was designed specifically to try to meet people where they are in the process of evaluating and establishing outcomes that matter to individuals. So I hope that we can talk a little bit more about that and you have a chance to check it out. So here are the 6 principles that are absolutely necessary based on the evidence that we've been collecting over the years. These are AARP's way of giving you a shorthand of the fundamental things that have to happen in order to reduce your risk for cognitive decline. I'm not going to have time to go through all of them, but being social, we have evidence to show people who are socially isolated, their risks for dementia are increased by 50%. I know that dementia-friendly communities are incredibly powerful tools to help reconnect people living with dementia and their caregivers to the community and make those social connections easier for people. It also fights stigma and really helps reintegrate people in the community so that we can have people living with dementia with joy and purpose for longer, and that we can all benefit from their experience and what they have to give. Engaging your brain, cognitively stimulating activities, managing stress. COVID has been a huge challenge for everyone, and anxiety and depression. This is a shorthand that mental well-being is absolutely wrapped up in your cognitive function as well. And so we have resources available around all of those issues. I think everybody knows exercise is important, but I wanted to leave you with these thoughts about exercise. One is what I was most surprised about. It's not just the 150 minutes that you're supposed to do a week. There are 2 other components that the Global Council pointed out that I wanted to underline for you. And those are, it's about how much you move throughout the day. And again, you guys were living the dream here with having Sue get you moving instead of sitting still. But they say that sitting's the new smoking, but I want to emphasize that part, that physical activity is important. And we're finding more and more about what's the quantity, what's the dose of exercise that works. Any movement helps. The more you do, wherever you are in your journey, the better. But just simple movement has benefit, whether it's stretching or it's your steps. We've recently, out of Wake Forest, there's a new study that's been released. The optimal amount, just simply walking, can be as beneficial for reducing cognitive decline as the more vigorous exercise that we talk about or you think about. But any movement helps. And then the other part, and we often don't think about this, is the strength building and weight part of it. There is not as much evidence about the relationship of strength building and cognitive function. But if you think about this logically, osteopenia, the things that make you frail, that make you vulnerable to injury, are this weakness that happens oftentimes with people who are older and are sedentary. So that strength building exercise is a very important component that I wanted to emphasize, and we don't talk enough about. Restorative sleep. The one tip I would give you here on sleep, set an alarm to go to sleep, not to wake up. Think about it as one of the most important, easy ways to improve your brain health, no matter where you are in your journey. And everybody's interested in Eat Right. We can talk more about that, but I know time is running out. We have a great report that's available to you that will tell you about the foods to include, to encourage, and discourage. I want to tell you that these things work. letting people know about the 6 pillars. We know through AARP's work on our brain health kits, where we spend just an hour sharing with older adults what they have learned with brain health, changes people's behavior. In fact, all workshop attendees who we've been able to reach over a 1.5 year period of time through virtual conversation, frankly, for the most part, 71% increased their awareness of brain health because of the workshop. 9 in 10 were likely to recommend the workshop, and half shared what they learned. People started eating more vegetables. People started exercising more. We don't know about how long we can get these people to sustain the behavior. That's sort of phase 2. But that's where communities come in. If you make it easy for them to get access to these foods, to exercise, to do all of these good things, it's much easier, and it's not the uphill battle to have these things happen. And so the top barrier for implementing all of these things, 1/3 of adults in another survey said, it's the fact that people around me don't do these types of activities. And so community, again, is so important to facilitate these behaviors. Yes, we have to have people know what activities could help, but even more than not having enough time, it's what people do in the community around them, their friends, their neighbors, that helps them sustain these behaviors. So I know I'm running short on time. I wanted to highlight that you can find many, many more things of information that we would love to share with you. Feel free to use everything that AARP has that's related to brain health. You can get to it through aarp.org/brain health, whether it's disease related, whether it's risk reduction, whether it's healthy aging, you can get it through that. But we also have very specific websites. The Global Council's reports are available, and AARP has a digital platform designed to help people sustain these behaviors. If you're a member of AARP, I'm guessing there's a big overlap here. I sure hope so. But you can get Staying Sharp for free. And I encourage you to take a look at that resource. AARP caregiving resources, I encourage you to look at that. We have some dementia-specific ones, but we also have information for caregiving. Efforts specifically around the disease and disrupting dementia are available at our Disrupt Dementia page. And we're working, and again, I think Dawn is part of the Alliance to Improve Dementia Care. And I wanted to point that out, that we're working together with 100 or more organizations, trying to get everybody who's involved in this together to come to common agreement about what needs to happen when it comes to improving care. So I will thank you, stop there, and hopefully we have time for some Q&A. I will also ask a favor. I'm getting close to having 2,000 followers on Twitter. If you're interested in hearing more about this topic, I hope you'll take a chance on adding me to your Twitter feed. You can find me at Sarah Lenz Locke. And if you get me to 2,000 on the anniversary of my 25th year at AARP, I will be deeply grateful. So thank you.
Thank you. Thank you so much. And congratulations on your 25 years of leadership and advocacy at AARP. And your timing is so perfect, as you commented on the intersection of age and dementia-friendly communities, as our state is going to be releasing a grant opportunity for age-friendly communities very shortly, within the next few weeks. And so I know that many community organizations on the in the summit today are looking forward to that opportunity and thinking how it can support their dementia-friendly and age-friendly efforts. And I know that the resources that you've shared will be well used, and we so appreciate your framing around brain health. So let's go to questions. Jen, I'll turn it back to you.
Thanks. Well, the one thing that we're learning in the chat is that you are rich with resources and everybody wants to know how to get to them. So we're trying to put some of those in, and we will also make sure that the ones you posted in your slides can be shared after the event as well. But Beth over at Family Means says she isn't finding the 7 questions to ask before creating a public messaging campaign. Could you maybe review what those are and tell us where the Global Council website, in the website that could be found?
Yes, so I'm going to pull up the report and see if I can get you a page number. But if you go to the Global Council on Brain Health, right here, if you can see that, globalcouncilonbrainhealth.org, and you go to the very first landing page, to the landing page, you will find a picture of our brain health report. You just click on that, and it will take you to a landing page that generally describes the report, and it'll give you a link to the report. I can't believe it. I always have this report. I'm flipping to pages every day of my life. So
I have to tell you, Sarah, that I'm relieved that I'm not the only one who's doing this, looking for all the papers that I think are directly in front of me all the time. It gives me great confidence.
Okay, thank you for that pause, because it gave me the perfect opportunity to find it. Okay, so here's what the report looks like. Can you see that?
Yeah.
And that picture will appear on the Global Council on Brain Health website. And then you'll see we talk about individuals first, and then we go to community. And so if you look on page 14, that's the section that begins the conversation about community. And on page 18, item number 3, the questions are: who's your audience? What are the benefits you seek for your audience? What are the proof points that you're going to offer for your goals to persuade participants to engage? What simple action steps are you going to recommend? And I just want to underline simple for a moment. We did this lovely 1-page summary of this massive report, and we took 10 steps to give people guidance about how to do this as an individual matter. People took a look at this and said, what? How many steps? That's just ridiculous. So we boiled it down. We tried to find the most salient ones and cut it further than half. We now only are talking about the 4 steps, right? First one is set a goal, right? But the simplicity and choosing your things are critical. What's the most effective tone for your message? Scientific, funny, emotional. Think about this, about how your audience is going to receive it. David Parks, you rock. Thank you. I see you put the link. Thank you. David is my great colleague and project manager at the Global Council on Brain Health. I'm glad he joined us today. And then who can deliver the message? It may not be me, right? If I'm trying to reach a community, it may not be me if I'm not a legitimate member of the community. So let's not have it be me. And how will you provide the feedback to your audience on their progress? That's kind of what I was talking about from an evaluation outcome perspective. If you don't give back to the community the feedback, what they've said, you have absolutely missed an opportunity, because they're not going to continue to engage with you if you're not giving them the feedback from their input. So those are the 7 questions that we want every group to ask before they establish their campaigns.
Well, thank you so much, Sarah, for joining us. It really is a privilege.